Welcome to Health and Living with me, Norma Currently. Today we're going to be discussing kidneys. The medical fraternity tells us we're meant to have two kidneys. Kidney beans are so named because of their resemblance. Today with Dr. Shepherd Kajawo, we will discuss what the kidneys do in your body and what common ailments affect Blair residents. Welcome, doctor. Thank you for coming on the show.
Thank you very much. Thank you for inviting me to come to the show.
What is a kidney and what exactly does it do in the body?
Okay, so a kidney is an organ that's important for normal living in human beings. Its function is to clean the blood from toxins. So as you know, when we eat, food gets metabolized and various toxins are produced. So the main role is to clean the body of the toxins. Secondly, they're also important to regulate the amount of water that we drink or eat in the food. So we need to eliminate that through our urine. So the kidney processes that. And it's also important to always remember that there are other important functions that the kidney does. For example, keeping us healthy and having energy. They produce hormones that ensure that by producing blood. So if your kidneys are not working, you will have low blood. They're also important in terms of calcium and bone healthy. So if you've got problem with your kidneys, again, you have problem with your bones, and you can have fractures, or some of the calcium can be deposited in your blood vessels. So they play a major role for our survival.
Okay, so as a nephrologist locally or a kidney doctor, what common ailments do you see Blair residents having?
Okay, so I always want to look at that in two aspects. So there's what we call acute kidney disease, which is essentially reversible, correctable potentially, and what we term chronic kidney disease, which is a problem that tends to happen over 3 months, and if not proper interventions are instituted, we can have serious problems. So the major causes of chronic kidney disease in our environment, in Zimbabwe in particular, Bulawayo, number one is hypertension. Okay. So uncontrolled hypertension will end up leading to kidney damage, and if that's not corrected, they can fail, what we mean kidney failure. Secondly, diabetes. So because of the food that people are eating, people are becoming obese, less active, we're having an exponential increase in the incidence of diabetes in general in the country and most of these African, what we call epidemiological transition. Okay. And so diabetes is an important cause. Then third cause is what I would call glomerulonephritis. These are various diseases that can eventually lead to autoimmune damage to your kidneys. There are a number of reasons why somebody will have glomerulonephritis. It can be triggered because your body has got antibodies that are reacting to your kidneys, for example in lupus nephritis, or infections. Various infections can cause what we call secondary glomerulonephritis. So if you've got HIV, it can eventually lead to damage to your glomerulus. So the glomerulus, essentially what we mean is like a sieve. You know, a sieve, it sieves the blood and cleans it. So the various those diseases that affect the glomerulus. The other diseases will be things like syphilis, hepatitis B, for example. Various other conditions that we call glomerulonephritis. Then the fourth thing that I always want to look at is that once you've got an acute kidney injury from a potentially reversible cause, if that's not addressed, that can lead long-term to chronic kidney disease. Common things that would cause this acute kidney injury in our environment are things like infections, sepsis. So you get pneumonia, diarrhea that's not corrected. It take time to go to the hospital today. If that's reversed, it can damage your kidneys. We also have got problems like, for example, toxins. So people take herbal medicines, for example, that can actually damage your kidneys. The other important things are things like medication that can also eventually damage kidneys. So medications, whether prescribed medication or not, that can lead to that. So I would say those are the four broad categories that are common in our settings.
Okay. And what symptoms do maybe your patients present with? So maybe if someone at home can also feel like they're experiencing a similar thing, they can come and get help.
Okay. So commonly in patients with kidney problems, as I've highlighted, its major role is water regulation. For example, they tend to swell. So early on, the face can become puffy. They can be swollen in the legs, the whole body. So that's a very common presentation. And also, you feeling tired, less energy, because one of the functions of the kidney is to produce hormones that increase your blood. So they can complain of that. They can also have problems with their skin. For example, it can become itchy, but some of the toxins that are being retained can cause skin itchiness. It can be generalized itchiness. That's another sign. Because of the toxins that are accumulating, they might have difficulties in sleeping, insomnia, for example. And also, it can also affect even your brain. So you can feel some headaches. Later on, people can actually be confused or even have seizures. That can happen. And in women, sometimes they can actually have what you call amenorrhea. So their monthly cycles are affected and periods can actually stop. And also in men, sometimes they can also have impotence, having difficulties with their sexual partners. So there's a broad range of symptoms. But having said that, it's also important to realize that in some people, you may not have symptoms, especially if it's early on. So it's always important to remember that and to have checked for important risk factors of kidney disease so that this is detected early.
Okay.
Yes, yeah.
So you had mentioned chronic and acute. So what are the managements for your kidney patients?
Okay, yeah. Okay, yeah. So if you find in our environment, we estimate that for about 5 to 10% of patients that are admitted in hospital actually have got acute kidney injury. In patients admitted in ICUs, probably about 50% have got some degree of acute kidney injury. The importance of acute kidney injury, as I've highlighted, it's acute, usually less than 3 months. And these things can be reversible. Okay, so it could be minor damage. If interventions are done early, you can prevent chronic damage. So that's important. So the most important thing is to recognize it early in people, especially with the risk factors. Stop the insult. So if it's the diarrhea, replace the diarrhea with the fluid. If it's the medication that's causing acute kidney injury, we stop the medication. If the herbs from the traditional medicine, we stop that. So that's the most important thing there. And once you've stopped the insult, if they are still progressing and having symptoms, there are also various interventions that can be done in hospitals. So number one, they can have fluids or renal replacement, what we call dialysis, if there is need for that. In certain cases of acute kidney injury, where we might not be very clear of the cause or the extent of the damage, there might be a role for further investigation, like renal biopsy, which can tell you more information on what's going on the kidney and whether specific medications are necessary. For example, immunosuppression. So that's a broad group of acute kidney. The most important is to recognize early and try to reverse. Then, unfortunately, for patients that have progressed more than 3 months, what we call chronic kidney disease, the management of these patients is generally to support the patient to try to preserve the kidney as long as possible to delay progression. That's what we tend to emphasize on. So that goes back to those risk factors that I've mentioned. Control the diabetes, control the hypertension, identify the glomerulonephritis, give specific treatment to that, and educate your patient about healthy living, losing weight, exercising, avoiding salty diet, which can worsen hypertension that can lead to further damage. So that's important with those general measures and dietary advice to the patient. You counsel your patient and give specific medication. We know now with advancement of medical science, there are some medications that are very important to retard progression of kidney disease. For example, with drugs that we call AC inhibitors, captopril, enalapril, can be useful in the setting. In diabetics, there are newer medications that are actually being shown now to actually reduce progression. So that's important to do that. Unfortunately, in those small group of patients that progress despite instituting these things, what will be important to do is to support them when they need to support the kidneys. So how do we support the kidneys? We can support them on what we call renal replacement treatment, which can include things like hemodialysis, peritoneal dialysis, or renal transplant.
Okay. All right. You mentioned some people have kidney problems because of medication the doctor put them on. Can you tell us about those kind of medications?
Okay, yes, yeah, definitely. Yeah, so that's an important group of patients, what we call iatrogenic or caused by the health worker or the hospitals unintentionally. Okay, so we give medication to help treat various conditions, but unfortunately, in some people, it's a very small group of people, you can have side effects. One of those side effects can be kidney involvement. I would give example, for example, painkillers. Okay, for people that have headaches, arthritis, various painkillers, what we call non-steroid or anti-inflammatory drugs. These are drugs like your Indocet, your pain ease, your diclofenac, for example. These drugs, they are very good for other conditions, but they can also damage the kidneys. And it's also important for even patients as they take this medication to be cognizant of this. And more importantly, for people that have had kidney disease before, to be aware that this medication can damage kidneys, and one needs to discuss with their healthcare worker about this possibility. Another example would be, for example, some medications that are very useful in treating HIV, they can cause, in a very small group of patients, they can cause damage. Okay, for example, a drug called tenofovir, very important drug, works very well. 98% of the time people are okay, but in 2% of the time you can have kidney damage from that. So it's always important for people to be monitored and if they are on some of these medications. Yes. Yeah.
Okay.
Yeah.
All right. You're watching Health and Living. Join us after the break, where we're going to be discussing the dialysis situation in Bulawayo. Please follow us on site.zw on Twitter and Instagram, and please subscribe to our YouTube channel, the Center for Innovation and Technology. Also, follow our website, www.site.org.zw. What can SITE do for you? The Center for Innovation and Technology offers a business opportunity to engage directly with your market online. We also offer media training workshops, live streaming, documentary production, and events management. For more information, visit our website and social media platforms. Don't forget to like, comment, and share. With SITE, you'll never miss a thing. Thank you for joining us. You're still watching Health and Living. We are here with Dr. Shepherd Kajawo, and we're discussing kidney issues in Bulawayo. So, Doc, there's a lot that's said about people traveling far away, as far as Harare, further, for dialysis, because there's always a conversation that maybe in Bulawayo we don't have some of these facilities. How far true is that?
Okay, yeah, so that's not true. So in government, maybe I'll just highlight that in Zimbabwe, the Minister of Health last year, they instituted a policy that dialysis had to be free for every Zimbabwean. Okay, so if you are a Zimbabwean, you can access dialysis for free from government services. There might be challenges in that sometimes some of the consumables might not be available and patients might have to buy to assist. So dialysis, what you call hemodialysis, it's available in government. It's also available in private in Bulawayo. So people can access that, those who've got funds in private. What's probably not available in this region is dialyzing patients that have got hepatitis B in government. So we don't have that facility in government, but we are hoping maybe by early next year we should be having that facility at Mpilo. But however, for those who can afford, that facility is available at Mater Dei Hospital. So people can get dialysis in Bulawayo. Just want to highlight that when you look at dialysis, there are two modalities of dialysis. There's what we call hemodialysis. There's what we call peritoneal dialysis. So hemodialysis, this is where you go to the hospital, you are connected to the machine through your veins, and you get dialyzed through that. Generally lasts about 4 to 5 hours, 2 to 3 times a week. Then there's also a modality called peritoneal dialysis. This is a facility that you can do at home. So you are trained to have fluid put into your tummy. it stays there for a certain duration, usually 4 hours. Then after 4 hours, you drain it. This can be done at home. At the moment, in Bulawayo, we are not offering peritoneal dialysis in government. It's available in Harare. But again, when you look at the overall picture in the country, only about 5% of patients on dialysis actually having peritoneal dialysis. So it's something that we probably would want to move and encourage patients to actually adopt this. And hopefully in future, more and more of our patients will have access to peritoneal dialysis.
Okay, so you mentioned hepatitis B being a hindrance in government. Why is that?
Okay, so to dialyze people with hepatitis B, we essentially need an isolation facility, okay, where they can dialyze to prevent spread to other patients it's mainly through contact. So that's number one. So that's what we need. That can be arranged. We're in the process of arranging that in Pilo. Should not be much of a problem. Then secondly, we need the staff also to be vaccinated against hepatitis B, just in case they get an injury, need to stick injury, for example. That's what we are pushing for, and we are hoping once all those things are done, is something that we should be able to offer our patients from Matebeleland as soon. Yes.
Okay. In addition to the dialysis conversation, there's always talk of shortages of nephrologists or kidney specialists. So why do you think that is, and what do you think maybe the government can do to curb that?
Yeah, no, you're very right. At the moment, I think there are 5 nephrologists in Zimbabwe. 4 of them are in Harare, and only 1, which is me, in Bulawayo. The major challenge is that we don't have nephrology training in the country at the moment. So those specialist doctors want to train further in nephrology. They have to unfortunately go outside the country to get that training. That's one of the reasons why we've got fewer nephrologists in the country.
Okay. But there's also a thing of medical tourism, which is where patients leave and go and get treatment outside of the country. So with kidney patients, there seems to be a lot of that, and you've highlighted a lot of the issues. What do you think we can look forward to maybe in the future?
Okay, so I just want to emphasize that so at the moment there are a number of nephrologists now in the country. We should be able to manage most of the problems here in the country. The only challenge that we have at the moment, and presumably that's why patients go outside the country, is the unavailability of renal transplant, which is one of the modalities of renal replacement therapy that we offer to patients. So it's currently not available in the country, and the major reason for why patients go outside the country is to have transplants. We hope maybe in future we should have this service available in the country, and we can also be a destination for other countries come and have transplants here.
Okay, in African culture, sometimes we have things about having other people's organs in our bodies. So do you feel like maybe that's something that will hinder us when we reach there and start thinking of some of these things like transplantation?
Okay. Yes. Yeah. So that can be impediment, but I think it normally evolves on educating the public about transplant and what it means. I think just want to emphasize that one can live healthy with one kidney. So it's very possible that you can survive with one kidney. And I think this is a message that needs to get out there, that you can safely donate one kidney and live a normal health lifestyle, as long as you've gone to your doctor, they've looked at you, and you're safe to donate. So that's important. So this will be for living related transplants. Then there's also what we call cadaveric transplant, where if somebody dies in an accident, for example, the organ, with the permission of the patient, prior to having deceased or the relatives, the organs can be used for the benefit of other patients. And this can change somebody's life quite drastically, and it's an important thing that hopefully in future we could be able to offer our patients this life-changing treatment.
In conclusion, can you give us ways we can keep our kidneys healthy?
Okay. So the most important thing is prevention, prevention, and prevention. That's very, very important. Especially looking at the costs involved with renal replacements, whether it's dialysis or a renal transplant. It's not cheap. It might be being provided for free by government, but it's not cheap. It's quite expensive modality. So we need to prevent kidney disease. How do we do that? If you are healthy, you need to make sure you regularly go to your doctor at least once a year, know your blood pressure, know your sugar, and be checked. And it's also important that there are some lifestyle interventions that we can do to prevent kidney disease. For example, exercising, preventing being obese. Obesity in itself is associated with glomerular diseases, for example. And the other important intervention will be stopping smoking, for example. We know that smoking can cause endothelial damage, can cause many other problems, including kidney disease. So we need to educate our patients about that, and also emphasize to our patients that use of traditional medicines in most cases can result in kidney damage or even damage to other organs. So people need to avoid these unregulated, unlicensed street remedies. Oftentimes they cause problems. And again, as we've highlighted, there are other medications that are good for our health, but in some cases they can cause kidney problems, and we shouldn't abuse these medications. The biggest problem we face is use of non-steroidal anti-inflammatory drugs. Okay, so people tend to abuse this. Little headache, flu, people take that, and that can cause kidney problems eventually to our patients. So that's important. And then the last bit will be just to emphasize that when we are not well, we've got acute kidney injury, interventions need to be done early, and that can potentially retard progression and prevent chronic kidney disease.
Okay. All right. Thank you.
Okay, thank you.
All right, guys. You heard it. If you feel unwell, go and get checked. No drinking. Watch what you eat and try and preserve your kidneys. Thank you.